Cervical cancer is one of the common cancer in the ladies, and as we all know that it is the main reason behind it is a human papillomavirus infection, which is very commonly happening in the early life of the ladies, mainly transmitted through the sexual transmission. And the prevention or the screening also is dependent on the same principle. The main primary prevention is based on the controlling or preventing the HPV infection, which is possible with the help of a very efficacious vaccines against this virus. And now most of the guidelines worldwide are recommending it to be starting very early age of the life. If we use these vaccines for prevention, then we can avoid almost 95% of the infections, which are very high risk for the cervical cancer development. Other type of prevention can be early detection or detection in the pre-cancer stage. So that is called screening. Again, we have very good test available to screen or early detect the cervical cancers in either pre-cancer stage or very early stage of the disease. So pap smear is very well-known test, and on top of that now there is availability of the HPV related testing, which has improved the sensitivity and specificity of the screening methods. And both of these tests are now very regularly recommended by the international guidelines to be started in the early age of the females. Starting from like 21 years of the age, it can be continued up to 65 years of the age, and with a frequency of like every 3 to 5 years, depending on which type of test we are using. So both of these methods are very efficacious in preventing such an important cancer. If we prevent or if we detect in very early stage, then the cure chances are very high, and that is the goal of doing early screening also. Thank you.
Hello, my name is Dr. Sheetal Vaidya. I'm a specialist gynecologist at Lifeline Clinic, Karama. My basic reason for being a panelist here is we are discussing what the WHO is guiding us to eradicate cervical cancer as a public health hazard by the year 2030. The motto is vaccinating close to 90% or more girls below the age of 15 years. 70% of women should be screened for the HPV and the high-risk PAPS tests by the age of 35 years and again by the age of 45 years. And the last one being 90% of patients with pre-cancers to be treated in time, and the patients with cancerous lesions to be managed with palliative care, the psychological, emotional and physical health care. That's the motto which we are going to follow. We need to understand the cervical cancer has very simple symptoms like intermenstrual bleeding, spotting, recurrent vaginal infections, and who are at high risk. The women who are already having recurrent bacterial vaginosis, T. vaginalis, sexually transmitted diseases, those with less immunity, and concomitant endocrine or lymphatic disorders which reduce the immunity. That increases the risk of this disease. So let's work towards eradicating this disease by 2030. Let's work together for it. Thank you so much.
My name is Majid Mohammed. I'm the Advocacy and Scientific Affairs Manager at the Friends of Cancer Patient charitable organization in the UAE. It is our great pleasure to be part of today's event on the annual cervical cancer awareness event to discuss more about the stigma and the cultural barriers that some of the women might face in our communities. Of course, there are many challenges and many concerns that are being circulated, and hesitancy from the women in order to get checked or get the vaccine. So I'm really looking forward to today's event to discuss more in-depth information about the topic and hopefully get out with positive results. Thank you very much.
Thank you very much.
Cervical cancer is a preventable illness. 90%, over 90% of cervical cancer is caused by human papillomavirus, HPV. And therefore, if we can work on preventing infection with HPV, then we will at least reduce cervical cancer incidence by more than 90%. There is a vaccine for HPV, and it is available in UAE. It's available in 9 to 14 years old school age, and it is also approved for 15 to 45 years in UAE. So it is available. The screening test for cervical cancer is available. Having the preventive measure, which is the vaccine, and the screening test for cervical cancer, both will contribute enormously to reducing the incidence of the disease in the community. And this is the big ticket item. How we try to achieve good awareness among the community to be able to get girls and boys immunized against HPV early on in life. We work with the Ministry of Health and prevention, and this is very important, the prevention part. We work with patient organizations like FOCP. We do awareness campaigns. All these awareness campaigns are in collaboration with the Ministry of Health or patient organizations. We need to work in an influential body that can help the public become aware of the disease and how to prevent it. We also do our own awareness campaigns like the HPV Protected .com website, which targets the public. There is lots of information on it that can be helpful to people who want to dig deeper into HPV and the prevention of cervical cancer. There are lots of efforts are being done, and there is more to come for sure. But awareness, immunization is the route to prevention of cervical cancer.